Hi, my name is Dr. Anders Munk. I'm coming here from Warren, Michigan from the Mendelsohn Kornblum Orthopedic Practice, and I'm going to talk to you today about SI joint dysfunction. I'm an orthopedic surgeon practicing here in Warren. I trained at The Ohio State University in both undergrad and med school, and did my residency at Henry Ford Hospital. The SI joint is located at the bottom of the spine where it meets the pelvic bone. It's an important part of the spine that transmits forces through the legs and up into the spine and upper extremities. The stabilization of the joint is achieved through muscles crossing the joint and strong ligaments that reinforce the architecture of the joint itself. Typically, there's very little motion in the SI joint. Women, on average, have a little bit more motion than men, partly due to childbearing. The causes of SI joint pain are like any joint. They are prone to painful conditions such as degeneration and injury. A typical patient who suffers from SI joint pain may just have low back pain. It may be located more in the lower back over the buttock area and can be present with many daily activities such as sleeping, walking, or sitting. The typical patient with SI joint pain may report to their physician that they have difficulty rolling over in bed, sitting for any prolonged period of time, taking a long drive, or even taking a simple step. The prevalence of SI joint pain is up to 30% of patients who have low back pain and up to 40% of patients who have had previous back surgery, including fusions. The incidence of SI joint pain is on par with patients who suffer from degeneration of the low back and hip arthritis. The diagnosis of SI joint pain begins with a good history. Next, your physician will typically do an exam, which may include some provocative maneuvers that may try to elicit the pain that you're experiencing. Most importantly, the patient should undergo an SI joint block or a regional block that should at least temporarily alleviate the discomfort. Most patients who suffer from SI joint pain will benefit from a conservative approach. Generally, this would consist of anti-inflammatory medications, physical therapy, and possibly a belt or corset. Other patients may benefit from injections, nerve burnings, and lastly, surgical intervention is generally reserved for those patients who are suffering at a high degree and have failed all other conservative methods. We use the iFuse for our SI joint fusions. This is a device that's inserted in the operating room through a small incision made over the buttock. This procedure itself takes approximately 1 hour to perform. With the procedure, 3 triangular devices are inserted across the SI joint and provide immediate stabilization. To date, we have 3 published papers that show the long-term efficacy in patients 5 years out from the procedure. Hi, Andrea. Thanks for coming in today.
Thank you, Doctor.
Why don't you tell me how we met?
Okay, so about 3.5 years ago, on July 19, 2013, I was in a rollover car accident. I injured my back. I had a fusion done in Grand Rapids. I got fused from T10 to L4, but since I live in the area here in Warren, I needed to see a local doctor. Thankfully, I came across you through some research. As time went by, I started experiencing some lower back pain. I wasn't sure if it was my lower back or if it was my hip, on my right side mostly.
So we found out that you had right-sided SI joint pain.
Correct.
And we did some injections and they worked. And then based on how you did with the injections, and the fact that they didn't last as long as we were hoping for,
Correct.
we went ahead and did the SI Fusion. And how have you been doing since that? That was about a year ago, I think?
Actually not that long. It's
Okay.
been 6 months. It was
6
in
months.
June,
Okay.
June 3rd of this past year, 2016.
Okay.
And I've been doing great. I saw results within the first month.
Great.
To the fact that I was able to sleep again, because remember, I was always complaining not being able to sleep. I couldn't walk. I couldn't get off my bed. And the first thing that I will complain to you was that pain and no sleeping. So, I mean, within the first month, I realized all the relief that I got from the SI joint fusion. And it was such a small surgery, such a small scar. Great results right away. I recovered within 2 weeks. I was walking again. So
And I noticed you in high heels
Yes,
today.
Correct.
Were you in high heels 6 months ago?
No heels for like 2.5 years since the accident.
Okay.
So that was great.
Okay.
Definitely. So everything's been doing great.
Wonderful.
I definitely recommend it.
Okay. So if you or a loved one suffers from low back pain, call me, Dr. Anders Munk at Mendelsohn Kornblum, and get back to life.